It's just after 2 o'clock p.m. here in Seoul. I'm Devin Whiting at the Arirang newsroom, and we're interrupting our regular programming for the latest briefing from the South Korean health authorities. That should begin momentarily. We'll cut straight to it when it does. Now, South Korea has reported 87 new cases of the coronavirus on Friday, bringing the confirmed cases in the nation to 8,652. The daily increase again dropped below the 100 mark after a single day above it. Of the new cases, 34 were in the worst affected city of Daegu and 14 were in Gyeonggi-do province. Seoul reported 17 new cases, while Incheon had 4. Gyeongsang-buk-do province, 13. South Korea reported 3 more deaths, bringing the death toll to 94. Most of the people who died already had underlying health conditions. South Korea and the United States have signed a $60 billion currency swap agreement. It's hoped the move will be a buffer for the local markets against the worst effects of the coronavirus outbreak. The Bank of Korea says the deal will be in effect for at least 6 months. Kim Yo-sun reports.
The central banks of Seoul and Washington have put pen to paper on a $60 billion bilateral currency swap agreement, a move expected to relieve a cash crunch caused by the rapid spread of the coronavirus. The Bank of Korea plans to immediately supply the U.S. banknotes it secures via the agreement. It also explained on Thursday that the move is expected to stabilize the local foreign exchange market that has been experiencing a rapid change in the exchange rate due to a recent shortage of dollars. The Korean won fell by 41 to close at 1,285.7 won against the U.S. greenback on Thursday. This was the lowest seen in over a decade as investors rushed to the hard currency, deemed as a safer asset.
The agreement will greatly help the financial market by stabilizing the recent rapid changes in the exchange rate between the U.S. dollar and Korean won.
Let us now begin our regular briefing for March 20th, Friday, on the outbreak of coronavirus here in Korea. As of today, midnight, we have a total of 8,652 confirmed cases. Of them, 2,233 have been discharged following full recovery. We have a total of 87 new confirmed cases yesterday, and newly discharged was up by 286 yesterday. And the regional breakdown of the confirmed cases is as follows. Still, most of them are clustered in Daegu and Gyeongbuk province, while we are also witnessing an increase of confirmed cases in the metropolitan area, including the city of Seoul. And investigations show that about 86% are related to cluster infection, while 19.4% are related to sporadic infections or those undergoing investigation. Yesterday, we had a total of 34 new cases in Daegu region. I will explain this a little later, but it was carried out among and identified among the increase of the nursing homes. And in Korea, we saw a rise by 17 people, and most of them were the workers or the contacts of those who are working at the Kurogu District Call Center. And in Seoul and Gyeonggi province, we also have an increase of those imported cases. And in Gyeonggi province, we also saw a rise by 14%, which was related to the Church of River of Glory, as well as the outbreak that was carrying out at the Bundang Jaeseng Hospital. In the Gyeongbuk region, we saw an additional 13 cases centering around social welfare facilities like the Bongwa, the nursing homes. And of all the outbreaks, about 58.7% are related to Shincheonji Church of Jesus. And in Seoul City, regarding the Seoul Kurogu District Call Center, we have a rise of 11 more cases. And these people were the employees who were working at the call center on the 11th floor. And 5 more new cases were reported among the families and those who have been come in contact with those workers. And up until now, we have have a total of 143 confirmed cases at this call center, and for the rest, we are still carrying out epidemiological surveys. And regarding the Bundang Daeseng Hospital, we have 5 more new cases reported, and they were the staff members as well as the families of the contacted people. And up until now, we have a total of 40 confirmed cases in this hospital. And in Daegu, about 79% of the enumeration investigations have been completed on the nursing homes in Daegu. And right now, at the Daesil sanatorium, we saw 10 more positive cases, and we are still conducting screenings and testings for the inpatients as well. Recently, we have been seeing a surge in the outbreak within Europe, including countries like Italy, UK, and Spain and France. And we have recently identified through the immigration quarantine here in South Korea, we have seen an increase of the important cases. Starting from 22nd of March, we will intensify our screening on those who are arriving from Europe. And starting from 19th of March, we have expanded our special entry procedures, and as we are seeing a surge in the positive cases among those who are arriving in Korea, we will strengthen our quarantine even more. So for those of you who are entering in the country from through Europe, they will have to go through the testings, and they will have to submit their health documents as well. And if they are tested positive, they will be moved directly to the hospitals or the life treatment center. And if they are tested negative, they would be under self-quarantine in their residences. If they don't have a permanent residence here in Korea, they would be moved to another facility. And we will, as for foreigners, we will also conduct our quarantine as well. And for all of the arrivals, the information on all of the arrivals will be shared through DUR with the medical hospitals, so that the hospitals could take use of this when they treat their patients. And we also like to urge those who are traveling abroad, if it's not necessary, we would like to ask you to postpone or cancel your travel, because we are seeing a global pandemic of the virus, and it has now spread to all continents, through even to Africa, Europe, and Latin America. And many countries around the world are also toughening their borders, and they are increasing and intensifying quarantine as well. So if it's not necessary, please refrain from going abroad. If you do travel abroad, please remember to wash your hands thoroughly, and please refrain from visiting multi-use facilities or hospitals at each of the destinations. And upon your arrival back to South Korea, please report the countries that you have visited to our staff members at the airport, and please participate with us in downloading all of the applications that are necessary. And we mentioned earlier that we will carry out self-quarantine for those of you who are entering from Europe. So please comply with these measures. And for all of those who have been newly arrived in Korea, we ask you to stay at home and refrain from meeting people. And if you have symptoms, please consult with 1339 call center and visit our screening centers. We have recently seen an increase on the outbreak among multi-use facilities like church and nursing homes and welfare facilities. We are seeing a slight decrease in the number of confirmed cases among the members of the Shincheonji Church of Jesus. However, we are still witnessing an increase of the sporadic outbreak, and we also see that we have a risk of imported cases. And in Korea, we still have those with slight symptoms who could also be contagious as well. So, as we mentioned earlier, for the young people especially, they could be asymptomatic at the first place. So when one person is exposed to a large population, we believe that this outbreak, the virus could infect more, has an infection rate of more than 30%, meaning that if one person is infected, this person could infect over 30 to 40 people, and it could have secondary and tertiary infections. So we believe that prevention is the best cure. And to this end, the KCDC aims to decrease and curb the social spread of the virus, and we are highlighting that the public needs to comply with individual sanitary measures as well as social distancing. And because the coronavirus is contagious among people, it is really important to keep social distancing. Especially, we ask you to refrain from going to crowded places, especially that are closed doors, and please refrain from religious gatherings and other multi-use facilities. Also, we are seeing an outbreak among the closed door small businesses. So we ask all of these businesses and corporations to adopt different measures, including flexible working hour and teleworking, so that we can decrease the risk of the spreading of the virus. And if you have fever or other respiratory symptoms, even though your symptoms could be mild, please refrain from going to school or work. Please take a good rest at home for the next 3 to 4 days and monitor your health conditions. And we are now moving into spring, so it's very difficult for us to just stay indoors at home. However, for the sake of your own health as well as that of your families and your neighbors and your friends, please refrain from going outdoors and stay at home. And please comply with the personal sanitary measures and as well as regular air circulation. And having balanced diet is also very important, so please take that into consideration. And please refrain from touching your faces with contaminated hands. And it is very important to clean the surfaces that you touch on a frequent basis. And in order to prevent the coronavirus outbreak, it is very important to keep social distancing and personal hygiene measures. And if you have any suspicious symptoms of coronavirus, do not visit the hospital directly, but consult with our 1339 call center or public health center before you go to the hospitals. The coronavirus is a respiratory virus that could infect anyone, so we believe that we cannot simply criticize those who have been confirmed. So rather, we need to provide them support to the confirmed cases as well as those patients who are still on self-quarantine. And the fact that one has been confirmed, it should not be a subject of criticism because this could lead to strong mental disorder or health, and this could lead to not going to the screening centers for testing, and the harm itself could go and affect a larger community. So please remember this, and that's it for me. Thank you very much.
And that'll conclude our coverage of this briefing. Stay tuned to Arirang for the latest on the coronavirus outbreak in South Korea. We'll be back at the top of the hour.